There are 1,000 different ways to recognize when once a week isn't enough. But really, what I would think of as a parent that are the three most salient points when recognizing when once a week is not enough is progress is stalled or symptoms worsen. So you have your teenager or your child in weekly outpatient therapy. Perhaps things were getting better. Now we're looking at a situation where progress has stalled, or perhaps even the reasons that that student was originally enrolled in therapy, now those symptoms are actually getting worse. That's one of those major indicators that we're going to have to pause, and once a week may not be enough. The second is the functioning at school or home is declining. When we think about the continuum of functioning, you know your child best, you know what's appropriate, you know what's out of the ordinary. And so when you see a marked decline in functioning, whether that be at school or at home, that can also be one of the big indicators that outpatient therapy might not be enough. And then lastly, a therapist recommendation. And you may be thinking, well, if the therapist recommends it, isn't that a pretty obvious sign that once a week isn't enough? And maybe, but I put it up there because if your therapist or your provider has recommended it, I implore you to take that recommendation seriously. Mental health providers and pediatricians do not make those recommendations lightly. So if that recommendation has been brought to your attention, I would encourage you to take it as seriously as the recommendation was brought and to seriously consider it. If you leave here with one thing, I really want you to think of the additional higher levels of care like medical care. If your symptoms persist, you're going to seek a specialist, or if your pain gets worse, you're going to go to the higher level of care. And it's the same way with mental health. If the outpatient once a week isn't working and you can start recognizing these signs, then we're going to seek out a specialist or a higher level of support.